Cast is now starting. All attendees are in listen-only mode.
Good afternoon, and welcome to the Racial Justice, Equity, and the Role of Child Care webinar. My name is Kiami Harris. I'm the Director of Learning and Events. This webinar is being recorded, and we will share with all registered attendees. The recording will also be available on the Child Care Aware of America website. So today we will be hearing from 3 national experts, and we will be some questions from you. So please use the question and answer box to share your questions. We know that we will not get to all of you, but we will do our best to answer as many questions as we can. Now I would like to introduce to you Child Care Aware of America's Chief Executive Officer, Lynette Fraga. Lynette began her career in early childhood as a teacher in infant, toddler, and preschool classrooms and has held positions at the local, state, and national level within the nonprofit, corporate, and higher education sectors. She earned her doctorate degree in family studies from Kansas State University and a master's degree in human relations from the University of Oklahoma and a bachelor's degree in special education from University of Arizona. Now I'd like to turn it over to Lynette.
Thank you so much, Kiami, and good afternoon, everyone, and thanks to everyone for joining us for this webinar series about how, out of our flawed and broken childcare system, we can create a new one that promotes equity for providers, children, and families. Following the recent murder of George Floyd and the anti-racism protests that erupted across the country, I have reiterated to our own staff and members and external partners that Child Care Aware of America's values reflect our commitment to our mission that each and every child has access to early childhood programs so that they might thrive. And as I say the words each and every child, I also acknowledge the pain and injustice due to racism and structural and institutional inequities and policies existing in communities across the United States. We must work against these inequities and their racist roots. Individuals, organizations, communities, and society is seeing the pain and demand for action pouring out into our national communities, evident in the protests across the country and calls for real change. Child Care Aware of America is committed to the work ahead with boldness and with humility, and the necessity for this work to be centered in the voices and experiences of people of color. For those who have been in this work and understand its history, early childhood and child care is squarely centered in the core tenets of social and economic justice, that equitable opportunities are available to every child so that they may grow and thrive, and there is much listening, learning, understanding, and work to be done for the field to truly meet its full potential and promise in seeing the impact it seeks and believes in. Child Care Aware of America describes itself as child-centered, family-engaged, community-based, and equity-driven. We need to ensure that these values effectively come alive in our own work. Right now, that work includes initiating honest discussions about and advocating for changes to the childcare system to make sure equity is a priority. That's the impetus behind this webinar series. Now I'd like to turn this over to Ami Gadia, but before I do, I want to introduce Ami, who is the Chief of Policy and Advocacy at Child Care Aware of America. Prior to coming to Child Care Aware of America, she was with the American Academy of Pediatrics, the AAP, where she was Director of Federal Advocacy and Regulatory Affairs. During her 5 years at AAP, she worked on critical federal policy related to numerous child and family-centered issues, including early childhood, child abuse and neglect, toxic stress, environmental health, injury, violence, and poison prevention, Native American child health, foster, adoption, and kinship care. Ami has testified before Congress and federal agencies numerous times and has appeared in the national print and TV press on various policy issues. We are so honored to have her work with us at Child Care Aware of America, and I look forward to her leading today's and moderating today's discussion. Ami?
Thank you so much, Lynette. I have the honor of introducing our distinguished panelists today. I'll start with Dr. Aisha Ray. Dr. Ray is a professor emerita of child development at the Erickson Institute and a distinguished fellow in the BUILD initiative. Dr. Ray has participated in the fields of child development and early education for almost 50 years. Beginning as a Head Start teacher, she has taught learners from preschool to graduate school, supported the development of community-based programs serving culturally, racially, and linguistically diverse children, families, and practitioners, has led professional development efforts for the early childhood workforce serving infants through elementary school learners, and consulted with numerous local, state, and federal entities. Her areas of research, speaking, and writing include racial equity and policy, and professional development systems in early childhood, multi-generational Black family child rearing, and the role of fathers in child rearing in low-income Black communities. At BUILD, she helped develop and lead the Equity Leaders Action Network. Dr. Ray stepped down in 2015 from the position of Senior Vice President for Academic Affairs and Dean of Faculty at Erickson Institute. Dr. Ray also serves as a Senior Advisor to the President of the National Black Child Development Institute. In addition, she has a long history of community activism and is currently working with others on issues related to the relationship of the Black community to early education, police violence, and racial justice. Dr. Ray has a PhD and a master's degree in developmental psychology from the University of Michigan at Ann Arbor, a master's in early childhood education from Loyola University of Chicago, the Erickson Institute, and a bachelor's in history from Grinnell College in Iowa. Next, we'll hear from, or we'll also hear today from Dr. Stephanie Currington. Dr. Currington is a tenured associate professor at the Boston University Wheelock College of Education and Human Development. She studies the social, cognitive, and language development of low-income and minority children within various ecological contexts, such as parent-child interactions, early childhood education programs, early childhood workforce programs, and related state and federal policies. He served as past associate editor for the Early Childhood Research Quarterly and for the Early Childhood Research Quarterly and for Early Education and Development. She was awarded a research policy fellowship from the Society for Research on Child Development and the American Association for the Advancement of Science, and she has worked in the Office of Child Care. She has served on education nonprofit boards for the National Association for the Education of Young Children and local Head Start programs. Research has been funded by the U.S. Department of Health and Human Services and the Office of Program Research and Evaluation, the National Academy of Sciences Ford Predoctoral Fellowship, the American Education Research Association, the Foundation for Child Development, the William K. Kellogg Foundation, and the Robert Wood Johnson Foundation. She earned her PhD in Developmental and Community Psychology from the University of Virginia. And also joining us today is Ashley Williams. She is a senior policy analyst at the Center for the Study of Child Care Employment at UC Berkeley. There, Ashley tracks, analyzes, and translates state and national ECE policy development with a particular focus on issues related to early educators. She's the former Associate Director of Advance, an ECE teacher preparation program at San Francisco State University. Over the past 16 years, Ashley has worked in several roles at ECE, including serving as a Start Core member, where she started her ECE journey. Ashley continued on to become a preschool teacher, Head Start Center Director, and early childhood teacher educator at the undergraduate and master's level at San Francisco State. She has experience with ECE policy and systems work, serving as the Senior Quality and Workforce Analyst for the San Francisco Office of Early Care and Education. Her professional work also extends internationally, as she has co-led a summer study abroad service learning program in ECE settings in the Vrygrond township of Cape Town, South Africa. Overall, Ashley's daily work and research is rooted in contributing to ECE systems in ways that dissolve and resolve inequities in ECE that negatively impact children, families, and educators. She is in her final year in the San Francisco State Educational Leadership Doctoral Program and earned both her BA in Child and Adolescent Development from and a Master's in Education, Master's of Arts in Education with a specialization in early childhood education, both from San Francisco State as well. Please help me introduce all three of our distinguished panelists. And I will turn it over now to our very first presenter, Dr. Stephanie Curitan. Stephanie?
Okay. Hi, everyone. I am so pleased to be here and to talk with you about this current issue, some of the current issues we're facing, and also the opportunity that we now have to revamp our early care and education system. So I've just prepared a few thoughts related to my dream wish list of what we would be rebuilding given now if we really had the opportunity to rebuild our system. And so when I was first approached by my colleagues to be a part of this webinar, I was eager to speak to this wide audience of providers from all auspices because I wanted to talk about how we can revamp our nation's early care and education system. And we specifically want to think about how we can revamp it so that it can be more inclusive of the desires, needs, and ideas of racially marginalized communities. So, and I want to highlight that while we begin this discussion, I want to make sure that I highlight that there's racism in all forms, and it's targeted towards, all forms are despicable, whether it be the hate speech or harassment that's currently being targeted towards our Asian Americans, or racism in the form of indifference to the COVID plight of our Native Americans. Yes, COVID is affecting all of our racially minoritized communities, but within the Black American community, the racism is taking on a specific form that is particularly violent and longstanding. And it's taking on a unique form of racism called anti-Blackness. And anti-Blackness is racism that's targeted towards Black people that has a historical and political legacy that justifies viewing Blacks as non-human and as commodities that can be bought, sold, or discarded at will. And anti-Blackness is what allows law enforcement to repeatedly suffer no consequences for violence and murder against Blacks. And they suffer no consequences because we exist in a society in which Blacks are viewed as non-human commodities that can be discarded and destroyed if they are viewed as problematic or damaged in any kind of way. So given this sort of anti-Blackness culture that we live in, it made me think about the question of how is this commodification of Blacks present in our education and early care system? And how is it that we might be engaging in processes and acts that allow us to view Black children as not entitled to the same human rights as their peers, and that allows us to discard or destroy them if the education system views them as damaged or problematic? So when I was tasked with this idea of thinking how we can revamp a system, I thought to myself, if we're going to revamp a system, I think we need to revamp it in such a way that requires the field to reconceptualize how we view Black children entirely. And it means that we have to retrain our brains to learn to see them as human, despite the pervasive and historical messages to the contrary. So I completely believe that we cannot begin this reconceptualization without a complete overhaul in our system around sort of the key areas that I mentioned here on the slide. And I just wanted to take a minute to briefly walk through each of these sort of pieces of the system that I see as critical to our rebuilding. So the first part is what I would think about describing as diversity and leadership throughout the system. And I specifically put this one first because one of the first areas in our system that I think needs to be rebuilt is our leadership structure. Those who are in leadership roles to create childcare policies, program guidance, and research are almost exclusively white. Even though the teaching workforce in childcare is more diverse than the K-12 system, the leadership within these childcare programs, such as center directors, et cetera, are more likely to be white than Black. And this lack of racial diversity in the leadership helps to create a system that perpetuates the same policies, procedures, and knowledge that contributes to support the historical legacy of a system in which Blacks are viewed as an afterthought. meaning that the system and the science was not designed to serve the needs or inspire the growth and prosperity of Black children and families. At best, the system can be described as merely allowing Blacks to participate, but this participation comes without any critical insight as to how the system needs to be modified in a way to meet the needs of Blacks. Instead, it's assumed that, well, what is good for white families in the larger population is also good for the Black population. But this is not necessarily true, especially given that research has repeatedly shown that daily racial stress has dramatic impacts on Blacks' physical and mental health. In fact, Harvard professor David Williams and his team have found that these violent murders of unarmed Black citizens, such as what we recently witnessed with George Floyd, has negative impacts on Blacks' mental health in ways that are not the same for whites. And this is all to say that because we live in a society that is racist and anti-Blackness is the foundation for this racism, Black children and families have needs that are unique and perhaps separate and apart from white children and families. Therefore, the logic of what is good enough for white families is good enough for Black families is simply not true. Black children and families need more support, more resources, because they suffer the brunt of society's ills in a way that the white population does not. So having equal status at leadership tables will allow these specific needs to be articulated, planned for, and investigated in a non-deficit based scientific way. And this cannot be done if there are no Blacks present at these leadership tables. And I like to think of it with, as they say in the Hamilton Broadway play, Black people need to be in the room where it happens. The second point that I wanted to make about revamping the system pertains to our education and training that focuses on racial equity. So this is an area that needs to be completely overhauled as well. Presently, our higher education programs and our CCRNRs and our state teaching certification requirements do not lend themselves to the development of a workforce that is racially sensitive or competent. What University of Pennsylvania professor Howard Stevenson describes as racial literacy is not present in our current workforce. The coursework, in fact, does not foster skills. These skills are actually non-existent, should I say, in higher education and in our training coursework. And there are presently no state teaching requirements that explicitly require teacher preparation coursework related to racial equity or Black children's development. So this results in a workforce that's ill-equipped to educate Black children in an equitable way and to cultivate their creativity and intellectual abilities, or to advocate for their rights and protections as children and students. And so when I think about the need for diversifying our workforce, I often say that we need to be educating our workforce in such a way that educators can reimagine their identity and learn to see themselves as social justice warriors for education. Such warriors fight for social justice by being outspoken and knowing how to use their power to dismantle a racist education system that has been designed to block Black children from having access to the level of education quality they deserve. And oftentimes people enter into our field because they love children and they view themselves as nice. But teachers have to be more than nice, because nice women don't dismantle racism and systems of power. And this quote harkens back to the famous quote from the Harvard historian Laurel Ulrich, who said that well-behaved women seldom make history. So I just want to give our workforce the license to act up in a way that demands that the world is better for children. And the other points that I wanted to highlight is also the need to diversify across teacher and our caregiver workforce within the field by creating a recruitment pipeline and leadership pathway for our Black providers. And I think that my colleague Ashley is going to go into more detail around that. So I will leave that to her. We also need to talk about how we expand our early learning standards and our ideas around what children should learn and what we should be expecting of them during these different developmental time periods. And one thing that I talk about is that we need to view having a positive racial identity as a critical aspect of social emotional learning. So being able to have pride in oneself and their ethnic group is essential. It's an essential foundation to having positive mental health, positive peer relationships, and therefore it is essential to social emotional learning. And we need to articulate it as such and demand that teachers conceive of it as such, and that they're able to educate in such a way. We also need to invest in training our workforce so that providers are better equipped to be responsive to children who need additional social and emotional behavior support. And what I mean is that we have to stop accepting as an excuse that providers are afraid of toddlers and preschoolers, or that these children are too disruptive to be allowed their right to education. What we see in the preschool to the school to prison pipeline is the epitome of anti-Blackness. It is the prime example of how we as a field allow Black children to be disregarded when they are viewed as problematic. And our early education workforce does not presently have the skills to provide children and families with the support they need when they are experiencing high levels of stress at home or in their communities. One of the last 2 points that I want to make is talking about how we make racial equity integral to our program quality measurement. So right now, most of our systems of accountability include measures of structural or process quality. None of them explicitly focus on issues of racial equity and social cultural equity. There's a tool that my colleagues and I have been working on, though, that does just that, and it's called Access. And the Access is a contribution to the field because it allows observers and people to go into classrooms and observe the equity that racially marginalized children experience in the classroom. And it allows also the capability to give feedback to teachers around the specific ways in which they can improve and provide resources and training and technical assistance around these very things. And lastly, I would say for my turn, is that during this whole pandemic and social crisis that we are existing in, I have felt overwhelmed and sad and slightly hopeful at times, because this is a time in which people are feeling a strong sense of advocacy about the issues that are going on, and they're very vocal about standing up against these issues. But it is my hope and my desire that the advocates that are now here speaking loudly and talking with us, that these advocates will stay true to the mission and true to the needs of the Black population, both in good times and in bad times, that we are building a consistent relationship that is grounded in knowledge and respect and justice, and that we will continue to not forget the inequalities that Black people face, and that we will consistently work towards that progress. So I think that those are the main points that I wanted to highlight for my turn, and now I will turn it over to my colleague.
Good afternoon, everyone. Can everyone hear me? Can you hear me okay? Great. Good afternoon. My name is Ashley Williams, and I'm the Senior Policy Analyst for the Center of the Study for Child Care Employment based out of UC Berkeley. I'm happy to be here today, but I have to be honest in my skin and positionality to say that it's painful to be here today and to be having to talk about things in a way in which are very real in my existence and my skin as a Black woman. And what's been coming to mind for me over the past few weeks, especially, have been something I wrote a few years ago, and it was, I feel my greatest grandmothers yesterday, today. And I think that's really important to center ourselves and to be thinking about how we are engaging and active in a way forward, because sometimes it feels like we're taking 10 steps back. And I want to just thank Dr. Curitin for her contributions. And I think that really provided a frame for some of the aspects of the work that I will be focusing on. And today, particularly, I'm talking about the early care and education workforce. That is the work that the Center for the Study of Child Care Employment has been focusing on for the past 20 years. Thankful to Dr. Marcy Whitebook for her vision, and thankful to Dr. Leah Austin for her leadership in this. And I think we're in a moment in time where our work is critically relevant and important, and always has been, and now it's really shining light to some of the experiences of the early care and education workforce. And so today my intention is really to provide just a brief overview of some of the evidence we have that really just evidence some of the arguments that Dr. Curitin has laid out for us today. But ultimately, my intention is to invite the audience, those of you who are out there today, to engage in some deep personal reflection. We are in a time where we are in an immediate need for change, but we also run risk of reinventing, perpetuating, maybe changing it up and calling it something else, but we're at risk of, you know, kind of creating the same inequities or disparities that we've been seeing in this country for some time. So we really, really have to think deeply about what we're seeing in front of us today and how we're going to work together to address. So if I could have you go to the next slide. So for the early care and education workforce, we've had existing issues. Some of the work that I've been leading for the center, I will refer to because CSCCE is a mouthful, has been for the last few months while I've been here, is talking to educators, early educators directly from different states and different roles. And it really has just, in those conversations, has provided qualitative anecdotes and just quotes and excerpts thinking about some of the existing issues that we already have. We know that early educators are some of the lowest paid, it's just one of the lowest paid industries in our country. Yet we know that a highly qualified, stable workforce with, the knowledge, dispositions, and skills to work with young children is a way to really give young children a strong start to their educational trajectories. Yet we see that sometimes there's a prioritization over the training or other aspects of the workforce that don't really get to their exact needs. And particularly one of the greatest ones is around their compensation, their livelihood, their ability to be able to take care of their own families, right? And we have to be clear and acknowledge that some of the aspects of the work that we do is built in caring for other people's children and other people's needs and not their own. And that is something that this group, when we were discussing for this webinar, where we can trace back to slavery, right? Where we see that we are Black women, we're here to take care of white children and cater to their needs, and not have the conditions and all of that stuff for them to be humanized and be human in their existence. And so we have to be clear that we see aspects of that in this work when we look at early care and education, and it being largely women, mostly women of color, who are called to take care of children and not compensated, and their well-being is not respected and supported in a way to do so. So if we can move to the next slide. So we also see amongst our workforce that there are also just wage gaps. $10.72 an hour is just the average or the median wage of early educators across the nation. We have states who are fighting for $15 an hour. So that reality at $10.72 in comparison of just minimum wage at $15 an hour. I'm here in Oakland, California, here in the Bay Area, where the cost of living is just really, really driving and eating away at our early childhood workforce, and they're not really able to make ends meet. And what we're seeing also is that Black educators are disproportionately affected by these low wages, right? So they are overrepresented in the categories in which they are the lowest paid. And we're also seeing that Black and Latinx educators are also relegated into some of the lowest paying positions. So we also acknowledge and understand that there are issues between, you know, the younger the child, the lower the wage. Teachers working with infant toddlers are usually those who are making some of the lowest hourly wages in the field, yet they are where we're seeing a lot of the diversity, right, in women of color. So there are some issues around race and equity and economic dignity that we're grappling with here. And also to acknowledge that these low wages, most folks aren't even having access to benefits or paid sick leaves to be able to take care of their families themselves. So we're dealing and grappling with some really, really major issues here that the folks who are caring for our youngest learners here are dealing with. And we see it here in the context of the pandemic and where we are right now. As the country was shutting down schools, almost every state, you know, was, you know, supporting childcare to remain open without regard for the well-being of the workforce. I was hearing from teachers about they weren't having access to personal protective equipment. They were really afraid for their own lives and well-being, right? And the risk that would come with this work. So we have to kind of acknowledge that there is a tension that exists that says, you know, essential workers, families have to get back to work, yet in some way, somehow, that getting back to work, we're overlooking the fact that there are actual people in these roles in childcare who are supporting families to do so. And in order for them to do that, they need the support that and the proper protection and health protections in order to do this work. And one of the things that really has struck me in my conversations with early educators over the past few weeks, especially in response to COVID-19 and the childcare response, is that they feel invisible. And to over and over hear from women, it was majorly women, but for human beings to say to you that they feel invisible, as if no one can see or they're not acknowledging their needs or what they need to do the work that they feel that they're called to do or are really inclined to do as far as childcare. It really struck me. And I think the implications of this is broad. And when we put this in the context of the recent movements that we're seeing in our country right now in response to the murders of Breonna Taylor, Tony McDade, Ahmaud Arbery, and George Floyd, right? So we are really at a moment where we have to reflect on some of the state-sponsored violence that we're encountering and noticing before cameras and after, that there is a devaluation and disposability of Black bodies and Black life in this country that needs to be addressed. And it's impacting Black maternal health. So even before our babies get here, our Black children, we're already seeing these disparities amongst our early learners, Black families, Black educators, and Black communities. So I think that there's a timely, this conversation is timely, and it's not gonna be an hour for us to get through this. So I will pause because we have lots more to discuss, and I look forward to what Dr. Ray is gonna share with us. Thank you so much.
Thank you, Ashley, and thank you also to Stephanie for starting us off and providing so much really important information. I'm going to share with you some of my concerns about how we're going to do this. That is, how we're going to really bring about profound changes in the early childhood field that help us to really eliminate racial disparities, to raise the real consciousness of our workforce and ourselves, and to be able to take the actions necessary to get there. So first slide, please. One of the realities is that, second slide, please. One of the realities is that racial justice and equity really matter in early childhood, and I assume all of you have joined this webinar because you believe that or are questioning that, or at least have questions you want to ask about it. But racial justice and racial equity are really both nouns and verbs. They're both the things we're trying to achieve, and they're also the processes we use to get there. And they focus specifically on how white supremacy, race, ethnicity, and social class influence a whole range of things: opportunities, outcomes, treatment, power, and privilege. Dr. Williams has talked about healthcare as one area in which we can see the direct impacts of racial disparities and racial injustice, but there are many. And these processes help us to look at that. There are deliberate, intentional processes that people engage in together within their workplaces, within states, within counties, within agencies, and with ourselves in our own development to try to begin to understand and to address how to unpack and dismantle racial injustice within our systems. They're implemented to identify and remove and replace systemic and structural factors such as racism that perpetuate inequality for children and families. And they also are really intended to help our workforce. And they help early childhood systems leaders, the workforce advocates, families understand how the structural inequality works and what is necessary to change it. Next slide, please. We, in early childhood, have a range of disparities that are clear, I think, to many of us. Our early childhood programs are far more segregated than pre-K-12 programs in terms of racial diversity and ethnic diversity of children. There are disparities in compensation that Ashley has spoken of. There are problems around disparities in access to programs, access to quality professional development, availability of programs for families, availability of professional development of high quality for our workforce, affordability, eligibility to receive programs, and so forth. One of the most important is that culturally respectful and responsive practices may not be available throughout all child and family serving sectors of the early childhood and early education system. And that is particularly problematic because, as we all know, diversity is a key part of those groups of children who are in our care and growing, so that our early childhood children and families are far more likely to be racially diverse and linguistically diverse than they were 20 years ago. Next slide, please. In addition, there are also diversities that reflect on this question of how are we going to do this. The early childhood workforce does not reflect the racial and ethnic diversity of children and families served in many ways. There's greater diversity in child care and family friend and neighbor care, and less diversity in leadership, as Stephanie pointed out. public policy advocacy and state systems leadership is insufficiently diverse. It is primarily white. Programs and services often do not have sufficient language competence that match the families and children for whom English is not their first language. We do not have high quality dual language programs generally. We do not have the capacity to deliver high quality dual language programs, though we know from research that those programs are particularly beneficial to children. High quality, culturally informed, anti-racist professional development, ongoing and across the careers of our early childhood workforce, is simply not available. So we have many, many years of anti-bias work led very much by Dermot Sparks and her colleagues at Pacific Oaks. That work has not actually bubbled up into an approach that now is infused across higher education, for example. And I want to stress the focus here on the word anti-racist. It is not, I'm using this word very deliberately because in my experience, the thing that is most difficult to get at is what do we mean by anti-racist practice in early childhood work and professional development. And I feel that that is something we really need to identify and hone in on. And there isn't professional development and coaching for anti-racist and anti-bias practices. It is simply also not available. We also know that our, next slide please, our early childhood workforce is really, can you go back one slide? Is confronted with both a range of problems and inequalities that influence all aspects of their lives. They, like many of our families who meet income eligibility to participate in early childhood programs, they share many of the challenges of income, safe housing, segregated communities in which there's a lot of danger for young children and for adults, opportunity and achievement gaps, employment structure problems in terms of inequality and wage structures, immigration policies and enforcement that affect our workforce significantly, portions of our workforce significantly, health disparities, mental health disparities, not having access to those supports sufficiently, and so on and so forth. So these kinds of challenges are not just things that are inside early childhood. They also are shaping our workforce from the outside and creating the kinds of stressors and challenges for them that I think were exacerbated in the pandemic that has befallen us. Next slide, please. So we are really at an extraordinary period in US history. If you've been around as long as I have, you know that this is really quite a remarkable period for bad reasons and also for reasons that may offer us opportunities. We're in the midst of a historic pandemic. It has not gone away. There is not a cure. Already 100,000 plus Americans have died in 3 months. Our federal government's response has been inadequate, increasing people's anxieties and worries about how they're going to survive. And this pandemic has disproportionately impacted Black, Brown, and Native American communities with higher death rates, higher infection rates. In addition, we are now experiencing, because of the pandemic and the shutdown of the economy, an economic depression. And I'm using the word depression because that word applies in Black, Brown, and Native American communities and poor white communities as well. In rural communities versus urban ones also. In a severe economic depression in which people are threatened with eviction, they may not have the money to see a doctor, and so on and so forth. Food insecurities, et cetera, have all been exacerbated because of the economic challenges that our workforce and our families are experiencing. And then the ghastly lynching of George Floyd in Minneapolis, witnessed by millions of people on their cell phones, has sparked what appears to be a powerful racial justice movement, demanding an end to racism, recognition that Black Lives Matter, and reimagining the role of the police in society. And it has spurred, I think, for us in our field, the need to reimagine as well. Next slide, please. The conditions that our early childhood workforce has encountered in these last 4 months are really daunting. Ashley described some of these. I'm not going to read all of these to you, but you know, this PowerPoint will be available, I assume, for anyone who wants to dig deeper in this, and you're more than welcome to contact me if you so desire. But the problems for our workforce that this pandemic has created, an increased mental stress, anxiety, uncertainty, depression, worries about their businesses closing, worries about infection. These are really profound challenges that our field has not faced in my lifetime, certainly, not in this way, in this kind of tsunami of challenges. And I think we need to think and pause and understand how we are going to both support the childcare workforce, but the early childhood workforce broadly around this time and because of these kinds of stressors and anxieties. And next slide. So a set of things I think we need to do are certainly to consider all of the points that have been made by my two colleagues on this panel. In addition, I think we need to act. We need to advocate for federal child care support. Of the $50 billion that has been requested to save child care. There is work in the Congress on this. We need to write our Congress people, our legislators, and our senators to support this. We need to get behind it in a big and vocal way and say this is absolutely critical. So I encourage all of you to do that, and Child Care Aware has been a leader in this, and I applaud all that they have done. We also, I think, need to center on Black, Brown, Native American, immigrant, and refugee voices in reimagining early childhood. Very often these conversations occur at the sort of policy tables that are very white, in which there are very few people who represent the communities that are being served, that should be being served by our programs and services. We need to really include provider voices in a significant way in rethinking what this field should be about. And we need to include family voices, and it needs to really be inclusive, not just Black voices and white voices, or brown voices and white voices, but these voices that represent the tremendous racial and ethnic diversity that is occurring in our early childhood programs, and represents groups that have historically experienced profound inequality in this country. So I encourage us to really act to, again, bring an inclusive community together to rethink what we mean by rebuilding our field and childcare, as well as the early childhood field. We need to understand how white supremacy and racism shape us and our field. This is personal work that we have to do, and I don't mean simply by ourselves, but by ourselves with others. We need to understand structural and institutional racism in our field and look at examples of it and think about how did we get to that point? How did we wind up there? And then work our way back to think of how do we unpack that and not let that happen again. We need to use data, and the data needs to be disaggregated by race and ethnicity to the extent possible. We need to join with others. This work cannot be done by individual, as in all social movements and social change. No one person brings about the change we seek. It has to be done collectively. And one of the inspiring things about the young people in the streets these days is that they really have created, I think, a kind of collective effort where they respect each other. They're in different groups, there's different leadership, but there's respect for voices, for different points of view, for arguing it out. I mean, in a sense, a real democracy, and we need to bring that into our field, I believe. We need to use your current work and authority to eliminate racism and other forms of bias in the organizations and entities and the work that you do. This is a critical thing. The work, we have to use what we are from where we sit to begin to ask the important questions about how are we making change that eliminates racism in our work, that advances equity, and builds a much more coherent and inclusive early childhood world that advances all of our workforce, but especially that workforce furthest from opportunity. We need to act for change where we stand in what we're doing, and we need to also assess constantly if what we're doing is making a difference. And so we need other people to reflect on that with us. I can say, gee, everything I do makes a difference, but other people might say, oh no, Aisha, not really. So we need the reflection of others, particularly often others who are not like ourselves. If we're just talking to people who look just like us, have our backgrounds, understand the world from our point of view, that is not going to begin to build the kind of inclusive community of change that I think we need. And we need to finally reimagine an equitable, exclusive early care and education system in which race and place and class and citizenship status and gender and all the other factors that we like to divide people with are eliminated. And that in fact we have Black children succeeding, brown children succeeding, Native American children succeeding, and all children in poverty succeeding. And we need to actively fight for it together. Thank you very much. So I'm going to return this conversation to Amy, I think. Is that right? Yeah.
Thank you to all of our distinguished presenters for their contributions and their thoughts and presentations today. We have time for a few questions and wanted to just get to a couple of them. So the first question that I will ask of our presenters, and feel free to take them in any order you would like. Does this pandemic and the powerful racial justice movement that seems to have emerged in the wake of the police murder of George Floyd offer opportunities to reimagine an equitable and racially just childcare workforce and system? And if so, what is the first step to beginning to build that? You know, you've all walked through in your presentations the elements that we need to create a more equitable, anti-racist childcare system. If our listeners are starting to think through, you know, sort of what's the first step in that journey, what might you say to that?
Well, a critical first step is people have to recognize they have responsibility, and then they need to take responsibility for the work. I think one of the things that I've done a lot of racial equity work in the field, and one of the things that frequently happens is individuals, sometimes in groups, will ask, well, tell me what to do. And my answer and the answer of my colleagues is you have to step into the space and you have to own it as your own, and you have to be responsible for the change you're going to bring about and for your own learning. So that's the first step. And you know, no one is going to come and save us. It's just not going to happen. This salvation is going to come to this field because we chose to make it happen. And that means we have to step into responsibility, both for what we've done wrong, like allowing childcare workers, living in a society that has allowed childcare workers to earn $10 plus. It's outrageous. It's criminal. It's racist. It's classist. It's all those things. We need to change that. And I know people, been trying to change it. I'm not in any way denying the hard work people have been doing. But going forward, we need more people to step into the space and take responsibility and join with others. So my colleagues probably have other thoughts as well.
I agree with Dr. Ray. I think a big critical first step is with ourselves and that internal reflection and kind of questioning. And I think that it's critical for us to bring to our work as researchers, as policy leaders and makers, as advocates, to start to really think deeply about what's going on here and our stance and positions and understanding, because implicitly or explicitly our positionality informs our work. So if you have a deficit view, if you have a view of a community in a way of not seeing them capable or as or dehumanizing, whether that be explicit or implicit, it's still there. And it's critical that we really turn to ourselves to think about how we approach our work, because that's going to impact how you listen to your colleagues. In my skin as a Black woman, I've experienced that. It's just like, oh, I've said it, it's not valid, or it's over sensationalized or dramatized, right? But believe people, right? Our experiences are valid and part of the way that we are experiencing our work. And so it's really critical for us to turn a lens inward to think about what is our role and how do we approach our work differently. There's no one of any race who should not be doing something differently at this moment. So I think it's for all of us to turn it inward and think about what is that next critical step for ourselves. And I think that my colleagues here today have really painted some tangible next steps. But the first is just to ask yourself.
So, okay, so I would just add to this question. I agree with what my colleagues are saying completely. And because I think that intrapersonal reflection and interpersonal sort of reflection is very much needed. But I also want to make sure that we take advantage of the policy window that is open right now. And Aisha was talking about sort of legislation that's currently being drafted and that will soon be on the floor. I would really like to see us as a community, as an early childhood community, think very critically and systematically about what should be in that legislation, and thinking about it so that when we are talking about what it should be in there, we're thinking beyond sort of the usual suspects. Like, we're thinking about how that legislation can be sort of crafted so that it supports family childcare providers in a more systematic way. We think about things, and so such as for things for them like special home loans, special business loans, as well, but making sure they have access, really deep, clear access to these different types of business loans. So I just really want us to also be thinking about sort of that structural system too, especially given now we have such a great opportunity to change things.
Thank you all for those answers. And we all have a responsibility, as almost Dr. Williams said, that, and I say almost because I think you're close to your PhD. As you said, we all have a role to do our part, right? None of us is off the hook, no matter how woke, or if you're, a non-Black person of color, you're not off the hook, right? And we all have a role to play. We all have a role to push our organizations to do more. CCAOA is, as Lynette mentioned at the top, right in the middle of all that. And, I think to the policymakers and to their staff, are you seeking out the input of Black men and women, while at the same time also not asking them to do all the work that is not theirs to do. So we are incredibly grateful to our three experts today for their participation, for joining us, for lending their scholarship and thought to this discussion. This is the first in a three webinar series, excuse me. The next in this series is going to be on June 25th. So please keep an eye out for that invitation. Again, I'm very, very grateful to all of you, Dr. Ray, Dr. Williams, and Dr. Curitan, and thank you all very much to our audience for being on today.
You're very welcome.
Thank you.
Thank
Thank you very much for having
Thanks
us.
for inviting me. Have a great day. Bye-bye.